St. Leonard Healthcare and Research Foundation has graduated its first batch of trainees under its community healthcare program. Welcoming the population, the CEO of St. Leonard Health and Research Foundation, Dr. Leontine Sinda, thanked the population of Bobinde village for their support to the foundation that was born in their community some 10 years ago. She further appreciated the partners, volunteers, and other stakeholders who stood by the foundation throughout the difficult moments. To the graduates, she reminded them of the foundation's goals, which are to improve the lives of the underprivileged in the remote and rural communities, while urging them to be good healthcare providers and serve their local communities with empathy and care.
The foundation is divided into 4 departments. We have the clinical department who's taking care of patients. We have the research department who's taking care of research to improve health, because we know without research, health cannot be improved. We also have the community engagement team called Humanitarian Without Borders of the St. Leonard Health and Research Foundation, which is mostly involved in remote, underserved, difficult to reach communities, villages and refugee camps in Cameroon, so that health for all, as stated by WHO, can reach everyone, no matter how far you are, no matter how difficult it is to reach you live. Let primary health care be a reality, especially for women and children that are living in those rural areas that are difficult, that do not even have a trained nurse to even give them first aid before taking them to the nearby hospital.
On his part, the mayor of Limbe 2 municipality, who doubles as the traditional ruler of Bobinde village, Chief Walker Daniel Ndive, applauded the efforts of St. Leonard Healthcare and Research Foundation for the medical assistance provided to the Bobinde community, in particular, and Limbe 2 subdivision at large since its creation.
Actually, you know, the only government hospital we have around here is Battle Health Center, which is a little bit far from us, and the other one is right in town at Ota. It is a relief to us because people don't need to travel long distances for emergency situations again. We can easily have a situation handled here. And what is even most interesting is that they render like community service, like a door-to-door service. Like it's not like somebody's hospital, it's like it's our hospital, it's our foundation, whereby we share together, we make it to grow, and we treat ourselves and manage the situation within ourselves.
The graduation ceremony took place under the watchful presence of the divisional officer for Limbe 2 subdivision, Serge Meke Abel, who called on the graduates to be ambassadors of the foundation as they go out to the job market to face the realities of the profession. He encouraged the CEO and founder not to relent her efforts in serving the community. Since its creation in 2010, St. Leonard Health and Research Foundation has been working tooth and nail for the socio-economic inclusion of young girls, women and children, to bring education and primary health care to the underprivileged population in the rural zone and refugee camps in Cameroon and Africa at large.